Hi, everyone. My name is Laura Goodhue, and I am the Executive Director of the Florida Alliance of Planned Parenthood Affiliates. And welcome to our press conference today to talk about the Reproductive Healthcare Protection Act. I am joined today by reproductive healthcare champions, Senator Lori Berman, as well as Representative Rita Harris, as well as Dr. Sujatha Prabakaran, an abortion provider with Planned Parenthood affiliates. And so I'm going to kick it off in just a couple of seconds. We are here one day before legislative session for the 2023 year begins. And we are going to be talking about some legislation that is meant to protect against government interference in some of our most personal private decisions and our right to bodily autonomy. So we're first going to hear from Senator Berman, who's going to talk a little bit about the legislation. And then we will hear from Dr. Prabakaran, who's going to tell us what she has been seeing since the 15-week ban in particular has been in place for about the last 6 months, as well as 8 months since Dobbs fell, since we've lost the federal constitutional right to choice. So, and then finally, we'll have Representative Harris follow up. So I'm going to turn it over now to Senator Lori Berman to explain the bill. Thank you so much.
Thank you so much, Laura, for having us today and helping us to organize this press conference. So we filed the Reproductive Healthcare Act this year because it is such an important issue. And we know that the Dobbs decision said that each state can do what they want. So Florida can be in the vanguard and can be the leaders in making sure that we do have abortion rights. And that's the message that we need to get out to everyone. But let's talk a little bit about what is going on in this country so we can understand why this is what the 15-week ban has been such a disaster, and why we need to go back to the Roe standards. So Republicans may have captured the Supreme Court and they overturned a 50-year precedent, but they haven't won over the popular majority of Americans, not even close. In fact, a strong majority, 57% of Americans disagree with the Dobbs decision, and 7 in 10 Americans believe that abortion should be a decision between a woman and those that she loves and trusts. Even in a Republican state like Kansas, 59% of voters rejected a proposed state constitutional amendment that would have said there is no right to have an abortion. So what's happening right now in this country is nothing short of tyranny of the minority. We're being ruled by right-wing extremist faction. And what they don't care about and don't look at is the higher mortality rates in states that ban about abortion. They don't care about the loss of longstanding constitutional rights. They don't care to provide women and even young girls with a choice if they are raped or impregnated. Nothing is more repugnant than the state using its power to control the lives and futures of women. To strip women of their dignity to plan their own families is abuse. So abortion bans like that 15-week in Florida are a human rights crisis in Florida. And that's the core reason we are bringing this bill, to protect women and to recognize comprehensive reproductive health care is a fundamental component to a woman's health, privacy, and equality. Our bill creates a private cause of action, allowing Floridians to sue the state, a local government entity, or any other political subdivision of the state to recover damages and reasonable attorney's fees and costs if their right to choose contraception, pregnancy, or abortion is denied, unduly burdened, or interfered with. We know that abortion access is an economic issue and that it's projected to cost over $300,000 to raise a child from birth to 18. So reproductive coercion by the state is not only abusive, but extremely costly. And the other thing that the Reproductive Healthcare Protections Act does is it's consistent with the Florida Constitution. Article 1, Section 23 of the Florida Constitution provides that, quote, Every natural person has the right to be let alone and free from government intrusion into that person's private life. It's a clause in the Florida Supreme Court that's been there for decades and has been understood to include the right to abortion. We want to make sure that in the state of Florida, that clause is enforced the way it was originally put in place. And so the Reproductive Health Care Act makes sure that women have the right to have an abortion up until the time of viability of the fetus. So I think it is more important than ever that we do pass this legislation. And I want to thank my House sponsor, Representative Harris, for choosing to sponsor such an important piece of legislation in her very first term as a state representative. And I know that we are not disillusioned because we know that this legislation will have a tough time moving. But what we want to show everyone is that the popular majority of Floridians are with us and that we won't lay down and accept the 15-week extreme ban right now on the books or whatever subsequent bill comes before the legislature. Perhaps the Republican Party, which is dominating the legislature, is unaware, but they have actually overreached. They've gone too far in stripping Floridians of their civil rights and their constitutional rights. Our bill is the remedy. I thank all of you for listening, and I hope that we will get the message out to the state of Florida that it is not okay to interfere with a woman's reproductive rights. Thank you.
Senator Berman, thank you so much. And thank you for always being a champion for reproductive rights and just for fighting this so valiantly and being outnumbered. We understand this is going to be an uphill battle, but it's also just drawing attention to the plight, of so many Floridians. What's happening right now is we are seeing people who need access to abortion from all over the South flock to Florida. Quite honestly, we saw that, the patients that Planned Parenthood health centers have seen from Texas, Louisiana, Missouri, Mississippi, Alabama, we're seeing an increase in patients since the Dobbs decision fell. But then at the same time, we're having to send some patients that are beyond 15 weeks out of state. And so this just is highlighting that we do not need political interference in these healthcare decisions, because it's really should be the doctors and the patients that are deciding on the best course of action and the best care. And so that's why we have Dr. Sujatha Prabakaran, who is here today to share some of her experiences in the clinics and with patients. And she's going to tell you just exactly how patients and Floridians have been faring since the 15-week ban went into effect on July 1st of this year. Dr. Prabakaran?
Hey, thanks, Laura. And good morning, everyone, and thank you for being here today. My name is Dr. Sujatha Prabakaran. My pronouns are she, Aya. I'm an OBGYN practicing here in Sarasota, Florida, at Planned Parenthood of Southwest and Central Florida. Since this 15-week ban went into effect last year, we've seen really devastating effects, both for my patients and also, I'm hearing from my fellow physicians around the state. And really the trauma and hardship that our patients are facing has been relentless already. And before this ban was in place, my physician colleagues and our legislative advocates, including Senator Berman here, we warned over and over again how many patients, countless patients, would be needlessly endangered by this abortion ban that's already in place. And the reality is, what we've seen on the ground is that the harm caused by this ban and also the 24-hour mandatory delay, which mandates that patients must have at least 2 appointments in order to get the healthcare they need. All of that the harm has been worse than you can imagine. Just a few weeks ago, I sat with a middle schooler in my office. She was 11 weeks pregnant as a result of being raped by someone close to their family. She was traumatized, of course, and so she kept the news from her mother, out of fear, until, it just became clear that she could no longer hide the pregnancy. And for me as a physician, that child's face is seared into my memory. And also her mother's panicked expression, when I explained that while she could still access care under the 15-week ban, they would still have to come back again for another visit because of the 24-hour waiting period. And, after they left my office, I just had so many just worries as they left. So, first, what if this child had kept this pregnancy from her mother for just a few more weeks? What if we had already a 6-week ban or a 12-week ban in place? And what if this young person didn't have the support of her mother and needed to get a judicial bypass? We're seeing, it's horrible, but we're seeing around the state that judges are denying minors the request for a waiver to get abortion care through the judicial bypass process. And that's happening at alarming rates. So I worried that even if this child had kept the assault from her mother and then somehow figured out how to get the abortion care she needed through the judicial bypass process, it's becoming increasingly likely that she might not have been able to get that care that she needed because that bypass request might have been unsuccessful. And so my question for lawmakers, for patients like this middle schooler is, who is helped by making this terribly difficult situation even worse by passing further abortion laws? And, how can the cruelty and harm from the ban that's already in place not be clear? Another patient I saw a few weeks ago came to see me at 15 weeks. She just didn't realize that she was that far along. She has a little one who was 9 months old. She just started a new job. And, she couldn't afford another child. She just physically couldn't sustain another pregnancy. But because of the 15-week ban, we were forced to send her out of the state for care that we could have safely provided in our health center. And that meant days off work, possibly losing the job that she depends on to feed her family. And her situation is devastating, and it's also not unique. These bans have real effects on the lives and well-being of people in each of our communities. And the effects are particularly harsh for people who are the most marginalized already. So, people with less financial means, are, Black and brown people in our society, people with differing abilities, just to name a few of the groups that are hurt. And finally, I want to stress, just how equally dangerous the 24-hour waiting period is. I recently cared for a patient who, after her procedure, told us that she'd been developing some unexplained leg pain. And we asked her some questions, and she revealed that she had a condition that had affected a previous pregnancy, but she'd been too scared to tell us because she thought that if she disclosed that condition, we might not be able to complete her abortion care. So we sent her to the hospital right away, and they confirmed that she indeed had a life-threatening complication from her illness that had developed between her first visit and her second visit. So were that 24-hour waiting period not in place, this patient would not have developed that dangerous complication, which put her life, the life of this mother of two, needlessly at risk. And so, again, these are just a handful of the patients that we've cared for in the last few months alone. Pregnancy is a time, when people deserve support from their communities and access to life-saving health care, including abortion care. And, as a physician, I know firsthand that the cruelty of this abortion ban and the 24-hour waiting period cannot be overstated. So I, join my colleagues here in urging the Florida legislature to honestly consider the significant harm that's already been done and to support Senator Berman and Representative Harris's bill that restores access to life-saving abortion care. Thank you all.
Dr. Prabakaran, thank you so much for sharing these stories. And as you said, we know this is just a sample of the hardships that Floridians have been going through. You know, the doctors, the medical staff of Planned Parenthood, they do this work like Dr. Prabakaran because they are passionate about their patients, about protecting care, and you know the fact that there are doctors all over the state that are speaking out about this, taking time out of their work days, you know, to go above and beyond and advocate. It really tells you something, right? And this is first and foremost, you know, abortion is healthcare, and that these patients don't need the opinions of male lawmakers interfering in their decisions. And unfortunately, if we, you know, if future bans are proposed, this situation will become even more dire. So, Representative Harris, thank you for being here. I know this is your first session, and you'll start tomorrow up there in Tallahassee. But do you want to share a couple of some comments with us about this very important bill that you have co-sponsored with Senator Berman?
Absolutely. I just want to thank the doctor for taking some time out and sharing those stories with us, and they're heartbreaking, and they just go to why we felt, the Senator Berman and I felt it was really important to file this piece of legislation. As the senator said, we're not disillusioned. We know this is a tough journey ahead of us, but we also know that this is a journey worth fighting. You know, people out there deserve access to abortion. Abortion is healthcare, it is medical care. And bodily autonomy is a fundamental right. It's an innate human right to have, you know, autonomy over your own body. So we filed this bill to show that the people in Florida deserve this. And not only do they deserve it, but it is what they overwhelmingly support. You know, I knocked on a lot of doors this summer, and I ran as a pro-choice champion. And these doors that I knocked on, the people who answered them, you know, they were concerned about access to abortion. Because of the fall of Dobbs. And our state constitution has in it baked a privacy clause, and we should be honoring that. And we shouldn't be chipping away at people's access to healthcare in ways that we have, and with extreme abortion bans like the 14-week abortion ban. So this bill hopefully brings us back. It repeals that. It brings us back to having access to abortion until viability. It takes away the 24-hour waiting period. It also allows doctors to practice their healthcare. You know, we have been hearing about that story about that young woman in Lakeland, and how, you know, doctors are flummoxed at how they should continue. This isn't how, you know, doctors don't go and spend the amount of time and dedication that they do in school so that they can be confronted with laws like this and have to figure out and navigate if they're going to get in trouble just by saving their patients' lives. So I think it's really important that, you know, we give the power back to the doctors to do their jobs, and we give the power back to the people to have control and autonomy over their own bodies. And, you know, I'm really hoping that this bill does get some consideration, but regardless, we're going to keep fighting this fight because it's worth fighting.
Thank you so much, Representative. And, you know, we've already seen a number of bills that are interfering with gender affirming healthcare that have been filed. I think, you know, hopefully we won't see any future abortion bans, but it does sound like that is what the Florida legislature will be considering. You know, Planned Parenthood affiliates have, along with some independent providers and doctors, have filed a lawsuit in state court against the 15-week ban. We understand the Supreme Court will be hearing that at the end of session. So although it is very clear that this is a violation of our state privacy clause, you know, we still have to fight that in court. And so, you know, for the sake of Floridians, who the vast majority, well over 50%, 2/3 of Floridians do not want to see political interference in reproductive health and rights. That includes Republicans, includes independents and Democrats. So this doesn't have to be a partisan issue. The vast majority of Floridians would prefer that our state legislature focus on the real issues, such as education of our students, the housing crisis, affordability. And unfortunately, you know, what we've seen is politicians, for their own political ambition, continue to file laws that make it more difficult for people to live their fullest lives. And so again, thank you for filing this legislation. And now I will take questions for the senator, for the representative. And I know Dr. Prabakaran has to leave, but she still has a couple more minutes if there's some press on the phone that would like to ask questions. And I see that someone has raised their hand, but I'm going to ask, I think it was Alana. Are you able to get off the phone and ask your question? There we go. Go ahead, Alana.
Hi, all. Can you hear me?
Thanks. Yes.
Thank you so much. This was a really great session. I appreciate you all taking the time. I have a question for Dr. Prabakaran. I was wondering if you've heard of more patients choosing to self-manage their abortions, and given that mifepristone may be pulled from shelves at some point soon, how you're feeling ahead of that. And then a second question, if we have time, for the Senator and Representative. How do you plan on battling future abortion bans with the current Republican supermajority? I know many are hoping that there won't be more restrictions past the 15-week ban, but I think we all know that Republicans are likely to at least introduce something more restrictive than the 15-week ban currently.
Thanks, Alana, for those great questions. So as far as self-managed abortion, we are seeing patients certainly coming from other states who are coming to us to seek, follow-up care after getting care, through means maybe that aren't through a health center or a healthcare provider. So we are here to help those patients. It is, to me, again, a demonstration of what happens when you limit access to healthcare. That patients, will use the means that they need to in order to get access to abortion care that they need, and sometimes that isn't as safe as we would want it to be. And, as far as mifepristone, we are certainly watching that and concerned about it. One of the things that case, again, highlights for me is that, healthcare should be driven by evidence and data. And we have really great data that shows, how effective and how safe medication abortion is. Particularly when provided with a protocol that involves both mifepristone and misoprostol. And so when there's political interference, like is maybe going to happen in this case, we know that it just causes more and more harm and forces patients to access care potentially in a way that is less safe for them. So we're certainly keeping an eye on that case.
Thank you, Dr. Prabakaran. And I think the second question was directed to Senator Berman and Representative Harris. Yeah, go ahead.
Yeah. I'll start, and then I'm sure Rep Harris can finish up a little bit. So I think the question was, what can we do? Given that we are in a supermajority situation, and we know that, but what we can do is what we're doing now, and that is to get the word out to the people of the state of Florida. They didn't elect myself or Rep Harris to be their doctors. We are not doctors. They didn't elect us to be making decisions about their reproductive health care, about their health care in general, because reproductive health care is health care. And we need to get that word out. And we need the people of the state of Florida to recognize that, to be calling their legislators, to be telling them this is not okay. And really, that's what we're going to be continuing to do with getting people educated about what's going on. Right now, there's no bill filed. Thankfully, we don't know what's planned. We're in the minority party, so we're not privy to that information. But if and when a bill comes out, we're going to be sure to shout it from the rooftops so that everybody knows, and that everybody can be calling their representatives and their senators and telling them this is not what you were elected to do. So we're just going to make sure we're going to be as loud as we can be, even if we are a small minority, and we are going to talk about the repercussions, just like you saw with the doctor. We had a press conference last year before the 15-week abortion ban, and we said this is going to be terrible for people in the state, and we are now seeing it come about, and we're going to talk about those issues. And if they change the deadline and go back even further, the repercussions are going to be even greater. So we are here to be the voice of reason and to let the people of Florida know that we don't have to live like this, and that we shouldn't have to live in a state where women cannot access health care. Thank you.
Yes, piggybacking on what Senator Berman said, getting the message out there, speaking it loud and clear, encouraging our constituents to follow and be a part of organizations that fight for abortion access so they can keep on top of actions that are going out or events that need to be attended. We filed this because we know, like I said, the fight is worth fighting. And so as long as we're out here fighting it, and we also know that, while we might be a super minority in the state house and in the chambers, we are not a super minority in the state. As we said before, the majority of people support abortion access. And so we're going to lean on the fact that the people in the state, this is not something that they want, and they don't want further restrictions.
Thank you so much. And again, that's why we're having this press conference, because I know that, Tallahassee's way up there in the north, and not everybody is paying attention to all the slew of bills that have already been filed last week that take away our freedoms to bodily autonomy, to manage our own health care. And so that's why we're highlighting this. And I think that's really important, right? Is that we continue to, share the bills that are being filed and what's being done about it. So do we have any other questions? Raise your hand if you have a question. Ray, do you see any in the queue? Okay.
No, I do not.
Okay. All right. Well, I want to thank everybody for being here. Please, if you do have any other questions or want to follow up with us, you can get in touch with us. And I want to thank you again for your advocacy. I know that we'll be watching, and hopefully as many of us as possible will be up there in Tallahassee. Dr. Prabakaran, again, thank you for your continued dedication to your patients and to your advocacy. And everybody have a wonderful day. Thank you so much.